In terms of exercise, yes, it's extremely important, but we as clinicians also understand that that's hard, not just because of the maybe physical disability that's been sustained as part of stroke, um, but there's a brain injury, and brain injury causes chemical imbalances that in and itself can cause fatigue and mood changes, motivation changes.
Mm.
So it's all kind of a part and parcel. So oftentimes what our patients also tell us is that the fatigue is kind of out of proportion to the actual physical limitations. And that has a lot to do with how, the brain is injured. That's the bottom line.
The fatigue is out of proportion. I love how you explained that because it's so out of proportion, it cannot even be explained. And sometimes there's a really big price to pay. I remember in my first few days of rehabilitation in Royal Park Rehabilitation Hospital in Melbourne, where I'm from, the 1 or 2 minutes of rehabilitation ended up becoming half a day recovery or longer. There seems to be a massive price to pay, and I can see how that can put some people off from getting back up the next day to let's do this again. So it gets better though. It does improve. Why is it important to get to the limit and then push beyond the limit or the barrier or whatever that is? Why is it important to sort of get there and do it even though it's really, really hard?
I would say that definitely kind of pushing the barrier is first disclaimer that you should always follow your physical therapist and
Yes.
occupational therapist advice, and definitely don't push yourself beyond what they say you should, because like you said, it's about consistency. It's not about pushing that barrier one day and not being able to get up for next 3 days. It's about consistently doing the maximum you can consistently. But also, too, the stroke recovery happens almost kind of exponentially in the first 3 to 6 months after stroke. And so I would say kind of pushing yourself to the maximum in that early phase and kind of getting the most off that early recovery period is maximally important. And I know that that's the hardest period as well when the stroke is quite fresh and everything is new. Frankly, your life has changed, in an instant. And so that's definitely hard. But also that's the kind of the right window to gain maximum benefits of what your therapists are asking you to do. So I would definitely recommend following their advice, keeping at it consistently, not overdoing it to the point that you can't get up the next day and can't do it again.